Marissa Rushlow with Linguabilities, coming to talk with you today about the difference between speech delay and autism. Realizing that your child isn't on track with developmental milestones can be scary, and it's easy for parents to jump to conclusions about what their child is going through, so it's okay to be unsure. For example, many parents may mistake delayed speech for autism because they aren't aware of other conditions that can cause language difficulties. And of course, the incidence of autism is rising in America over the past 20 years, so it's all on our minds. But remember that only a medical professional can diagnose your child. In the meantime, let's review some differences between a speech delay and autism. So what is a speech delay? Well, according to child developmental experts, children should reach certain speech milestones and certain language milestones by certain ages. When a child fails to reach one or more of these developmental milestones, then you may have reason to suspect a speech delay. So some of the milestones or the things that you want to look out for include not babbling by 4 to 6 months, not gesturing or saying words by 12 to 18 months, not obeying simple directions or combining words by 2 years, or not speaking in simple sentences and using pronouns by 4 years. So what causes a speech delay? Well, there's many potential causes. It could be a brain injury, hearing difficulty, learning differences or difficulties, and none of these symptoms necessarily mean that your child has autism. So now let's switch gears and talk a little bit about autism. Autism spectrum disorders comprise a wide range of traits that can manifest differently for each person. Regardless of severity, autism tends to affect a person's ability to socialize, communicate, and learn, and may cause them to behave differently from their neurotypical peers. So some common traits that you might see in autism are avoiding eye contact, even at a young age, preferring to be alone or placed side by side rather than in a collaborative fashion, not responding to their name or gestures, repeating words or phrases, which is known as echolalia, or having stereotypical body movements, struggling to adapt to even slight routine changes. So the cause of autism is unknown. There's been a lot of research done that we think it's a combination of some genetic and environmental factors, but the ruling right now is we just don't know, unfortunately. And there are a lot of similarities between speech delay and autism, so it could be easy to get them confused. So how do we tell the difference? Well, first, the difference may be more obvious to medical professionals than parents. In fact, as we said, there are many similarities in the traits of speech delay and autism. For example, autism can manifest in delayed speech, but speech delays are not necessarily an indicator of autism. And if we know that a hearing impairment could be a precursor to a speech delay, then you might say, oh, well, they're not responding to their name. Is it because it's autism, or is it because it's a hearing difficulty resulting in a speech delay? So children with speech delays may struggle with making certain sounds, expressing themselves with the right words, or retaining spoken information. Whereas signs of autism could include these things, but they also tend to come with some other recognizable traits like the echolalia, stereotyped behavior, or social difficulty. So regardless of your child's struggles, speech therapists can help them improve their abilities. Ask your child's doctor about speech therapy, or consider searching for an online provider like Linguabilities. We offer kids speech therapy that your child can do from home, where there are fewer distractions and they feel the most calm. If you're interested in talking with Linguabilities about your child's speech, check out the link in the description to learn more. Until next time.